Welcome to this explainer. I am absolutely thrilled to have you here today. Listen, millions of people look in the mirror every single morning and notice something that is honestly deeply unsettling. Maybe it's a few extra hairs left on the pillow, more strands than usual trapped in the shower drain, or maybe you've just noticed a widening part. We all know hair is so much more than just a collection of strands on our heads. It's tied to our identity, our health, and our confidence. Losing it carries a massive emotional weight. But today, we are going to clear up the confusion and completely demystify the science of hair loss. Okay, let's dive into this. At first glance, a piece of hair might just look like a simple, dead string of protein. But beneath the surface of your scalp lies one of the most highly active, incredibly complex microscopic factories in the entire human body, the hair follicle. The real question we need to answer is, are these tiny factories just taking a quick, totally normal break? Or are they actually shutting down? To figure that out, we are going to break this all down into 5 neat categories. We'll cover the baseline, internal sabotage, system shocks, the danger zone, and finally, the resolution. Starting off with category 1, the baseline, or normal hair function. Let's look at exactly how this incredible biological engine works when it's operating at peak performance. And this brilliantly illustrates the continuous loop of hair production. You see, every single hair operates on its own independent timeline, cycling through 4 distinct phases. First up is anagen. This is the active growth phase, and it lasts anywhere from 2 to 7 years. Next is catagen, which is just a super brief 2 to 3 week transition period where the follicle actually shrinks. Then comes telogen, a resting phase that lasts a few months. And finally, exogen, which is where the old hair naturally falls out so a brand new one can grow. Because of this continuous cycle, losing 50 to 100 hairs a day is perfectly normal. It's literally just the factory hitting the reset button. So if you've been feeling anxious about a few loose strands lately, let this put your mind at ease. A healthy scalp contains somewhere between 80,000 and 150,000 hair follicles. And right at this very moment, a massive 85 to 90% of them are actively churning out new hair. Only a tiny fraction, about 10 to 15%, are resting. You don't lose all your hair at once simply because every single follicle is working its own independent shift. This brings us to an absolutely crucial distinction in dermatology, the difference between hair shedding and true hair loss. Hair shedding is really just a temporary disruption in your normal growth cycle. It's a quick pause in production while your body recovers from something. True hair loss, on the other hand, means the follicles themselves are either producing structurally thinner hairs or the factory is sustaining actual damage. Basically, it's the difference between a minor temporary hiccup and a condition that actually requires some medical intervention. Moving right along to category 2, internal sabotage. We'll look at genetics and autoimmunity and what happens when the body's own programming turns against perfectly healthy follicles. So, the crucial point is how our genetics interact with normal body chemistry. This interaction often leads to androgenetic alopecia, which is pattern hair loss. This is literally the most common hair loss condition in the entire world. It involves a hormone called dihydrotestosterone, or DHT. Now, DHT is not inherently bad. In fact, people with this condition actually have completely normal DHT levels. But their genetics just make certain hair follicles highly sensitive to it. With each cycle, the follicle shrinks in a process called miniaturization. The factory gradually produces shorter, thinner hairs until it just eventually stops producing visible hair altogether. But, sometimes it's not genetics at all. Sometimes it's the immune system making a huge mistake in attacking the follicle. We call this the autoimmune spectrum. It can start as alopecia areata, which causes these smooth, round, bald patches often marked by tiny hairs that look like exclamation marks. In rare cases, it can progress to alopecia totalis, which is total loss of scalp hair, or even alopecia universalis, affecting literally every single hair on the body. But here is the incredible, truly hopeful thing about this. The immune system forces these follicles into a resting state, but it usually doesn't destroy them. The factories are dormant, they are not demolished, and that means regrowth is absolutely possible. All right, part 3, system shocks. This covers stress, hormones, and behavior, the environmental and systemic triggers that can abruptly bring the hair growth cycle to a screeching halt. When your body experiences a major shock, I'm talking a high fever, a major surgery, severe emotional trauma, or even those massive hormone shifts right after childbirth, it triggers a condition called telogen effluvium. Basically, the body panics. It pushes thousands of active follicles into the resting phase, all at the exact same time, just to conserve energy. Because that resting phase lasts a few months, this causes a delayed, pretty dramatic shedding of hair long after the stressful event has actually passed. Now contrast that
with anagen effluvium. While telogen effluvium disrupts the resting phase and causes that delayed shedding, anagen effluvium attacks the active growth phase, causing rapid, immediate hair loss. The most common cause we see here is chemotherapy. Chemo is designed to target rapidly dividing cancer cells, right? Well, hair follicle cells are actually among the fastest dividing cells in the human body. The medication just can't tell the difference, so those growing hairs weaken and break off within a matter of days or weeks.
Let's move to and see how this builds when we're dealing with slow, chronic stressors. Gradual hormonal imbalances, things like polycystic ovary syndrome or PCOS, an underactive or overactive thyroid, or the drop in estrogen during menopause, can slowly, subtly wear down follicles over years, causing diffuse thinning. Then we also have behavioral shocks. Traction alopecia happens when tight braids or ponytails cause chronic mechanical tension. You're physically pulling at the roots over time. And trichotillomania is a recognized mental health condition where repetitive urges lead someone to unknowingly pull out their own hair. Category 4 is where things get really serious, the danger zone. These next conditions raise the medical stakes entirely because the hair factory is being permanently demolished. This category is known as scarring alopecia. In these specific conditions, inflammation actually destroys the hair follicle and completely replaces it with irreversible scar tissue. And I literally cannot stress this enough. Early medical diagnosis here is absolutely critical because once a follicle is replaced by a scar, it loses its ability to grow hair forever. It's done. So you need to know the specific warning signs so you can intervene early. For frontal fibrosing alopecia, you want to look for a slowly receding front hairline, which is actually often accompanied by thinning eyebrows. For CCCA, which is a scarring condition that frequently affects women of African ancestry, watch for thinning that starts right at the crown and spreads outward. And for lichen planopilaris, look for burning, itching, and tiny red scales surrounding the follicles. Catching this early and getting treatment is literally the only way to stop the inflammation and save your surviving follicles. Sometimes, though, the danger comes from an outside invasion. Tinea capitis, which is commonly called scalp ringworm, is actually not a worm at all. It's a highly contagious fungal infection. These fungi invade deep into the hair shaft itself, causing weak, broken hairs and really scaly patches. And because this infection sets up shop deep inside the follicle, regular over-the-counter shampoos simply cannot reach it. It requires prescription oral antifungals to cure it, which stops the severe inflammation and potential scarring in its tracks. Which finally brings us to part 5, the resolution. And the really good news is that the modern medical landscape for hair loss is incredibly hopeful and empowering. Before jumping into complex treatments, doctors are always going to look at the basics. Honestly, sometimes the solution is beautifully simple. A quick blood test might reveal a nutritional deficiency. Maybe you're low in iron, zinc, or vitamin D. Or the hair loss could just be a side effect of a new blood pressure medication or a blood thinner you started taking. Just correcting a simple vitamin deficiency or having your doctor adjust a prescription is often all it takes to let those factories return to their normal, healthy cycle. Now, what's really interesting about this slide is that it perfectly illustrates how the exact cause dictates the exact medical intervention. There is no single magic cure for hair loss because hair loss isn't just a single condition. If it's genetic, we use treatments like Minoxidil, Finasteride, or hair transplants. If it's an autoimmune issue, we have modern medical miracles like JAK inhibitors, which actively block inflammation pathways, or corticosteroids to calm the immune system down. And if it's scarring, aggressive anti-inflammatories are used to aggressively protect whatever is left. Identifying the why is what unlocks the how. Ultimately, hair isn't essential for our physical survival, which means it is very often the very first thing the body deprioritizes when something else is going wrong. It acts as an incredible mirror for your overall well-being. So if you notice your hair thinning, don't panic, but definitely don't ignore it either. Think of hair loss as a vital diagnostic signal. What is your body really trying to tell you? Listening to that signal is the very first step, not just to saving your hair, but to taking full control of your overall health.